Right, Nikki, have we started recording? In which case,
oh yeah, it started now. Yeah.
Say that there. Yeah. Oh right. Okay. Great. Well, thank you everybody, and good afternoon, and welcome to this Reading's COVID-19 Outbreak Engagement Board. And I've got a few things. Well, the main thing I have to remember is I've got a very lengthy chair's announcement to read through. I think the most important thing around this meeting is that whilst we want to be a relaxed and an open meeting, we do want to observe a few rules to make sure it works properly. And probably the most important of those is that if anybody wishes to speak, if they can indicate in the meeting chat, that would be great. I'll keep an eye on that, and we'll call people to speak. If people can keep their, I think we're all getting used to the importance of keeping yourself muted when you're not speaking, and also we're finding that these things are progressing much better in these kind of meetings if people keep their cameras off, other than the chair and the person speaking. So welcome everybody. I'm going to read now the formal chair's announcements because there's legal things that I need to say to you. And that is that to inform everyone present that this meeting will be recorded on Microsoft Teams and then be uploaded and repeated on the website. Councillors, officers and partners attending will be asked to introduce themselves. This is for the benefit of the public and also to ensure that the clerk, Nikki, knows who is in attendance and that everyone can hear and speak to the meeting. So if anybody does speak, if they can introduce themselves, please. To help me manage the meeting, if any members of the board wish to speak during the meeting, please can indicate you wish to speak in the chat section, as I said, on your screen, then wait to be called. This will avoid anyone talking over each other. When not speaking, all attendees should also put their microphones on mute and switch off their cameras. When called to speak, please switch on your camera and unmute your microphone and pause for about 3 seconds to allow a slight time delay in connection. But a number of us, I'm sure, will keep forgetting to unmute ourselves, and that's fine. I'll just remind people. If you are addressing a meeting, it would be best if you can have your camera on so that people can see who is speaking. However, we are aware that we're at the mercy of individuals' broadband services, so if it's possible that loss of connection may happen, or if your connection is poor, you may find that it improves if you turn your camera off, and we'll understand if that is necessary. Okay, so welcome everybody, and the first item is apologies. Nikki, do we have any apologies today?
Chair, I've got apologies from Deborah Glassbrook. I think Vicky Rhodes is here in her place, and from Councillor Stanford Beale.
Okay, great, thank you.
Got any other apologies to pass on?
Okay, that's fine. Thank you, Nikki. So the next item is the meetings of the meeting held on the 4th of September. Obviously, things have moved on rapidly since then. Hopefully people have had a chance to look at those minutes. If anybody's got anything they wish to raise, either any points to raise on them or any matters of accuracy, now's your moment to indicate. And if I don't get anybody indicating in the next few moments, we will sign those off as the agreed minutes of the last meeting. And as the very nature of these meetings, most of what was discussed, they'll be subsequently on today's agenda as well. So I don't see anybody indicating, so we will sign and agree those minutes, which then takes us on to questions for members of the public. And I have Mr. Tom Lake. I know I saw you earlier, Mr. Lake, so if you'd like to ask your question, and I'll try and find the answer amongst my pile of papers on my desk. Thank you.
Right, I apologise if this question has been somewhat overtaken by events. I hope it will still be useful. The themes of the COVID-19 outbreak engagement plan do not mention isolation. Can the virus be contained without isolation? Is there no role for local public health and the local authority in maintaining and supporting isolation?
Thank you, Mr. Lake. And I realise and I said about everyone introducing themselves, I should have introduced myself at the very beginning. I'm Graham Hoskell, I'm the lead counsellor for health Wellbeing and Sport and the chair of this engagement board. Thank you. Right, yeah, thank you for your question, Mr. Lake. I very much suspect that we share a belief in the critical importance of isolation as part of the test and tracing in order to combat COVID-19. And in response to the first part of your question, I would absolutely say the virus cannot be contained without isolation working. It is therefore highly alarming that the government's own scientific advisors estimate that less than 20% of contacts advised to isolate do so fully. My own view is that the inadequate financial support from government to those isolating means that many cannot afford to do so and may also discourage some people from passing on contacts. The local outbreak control plan for Reading covers contact tracing as numbers 4 and of the 8 themes, and this is on the RBC website. Contact tracing involves the identification of close contacts of a case and advising them of the requirement to isolate for 14 days. The isolation is an important part of how we look to control the virus as it breaks potential chains of transmission. Until recently, the NHS test and trace system was run nationally without a role for local authorities. However, in the last 2 weeks, we have taken on a role of ensuring that we successfully communicate with local residents that have not been reached by the national system, I should say, and thus ensure the necessary isolation is occurring in our town. We will be providing more information about this local service later in the agenda for today's meeting. We've also been encouraging isolation for those who are cases or contacts through our regular communication. This includes our resident email, social media channels and advertising across the town. We know that some people face financial difficulty if they're required to isolate and cannot work from home. We've therefore ensured access for Reading residents to the Test and Trace Support Payment Scheme, and this ensures that it is as easy as possible for people to isolate when they need to. I think that's the end of my answer. Mr. Lake, do you have a supplementary? So I think I only had the last bit. Was that a no? Because you've unmuted yourself.
Sorry, double click. I beg your pardon. Double click. So I understand that the local authority doesn't have contact details for those who are isolating, but whom it didn't trace. So, but however, the GPs do. So just a thought that would it be helpful for GPs who do have contact information to offer a referral to local public health or local support to those patients who are isolating? Thank you.
Yeah, thank you, Mr. Lake, and that is a helpful point. Clearly, we're going to come on to it later, I think, in terms of the One Reading hub and support to people across our town. We need to get those messages out, and as you're absolutely right, local GPs will be an invaluable way of getting that out. So thank you for that suggestion. Right. There you go, I muted myself that time. We don't have any further questions, so we'll move straight on to item number 5, which is the local COVID-19 data update. We've got David Monday, a consultant in public health. I think he's going to be introducing this. So David, the floor is yours, so to speak.
Great. Thank you, Chair. As introduced, I'm the public health consultant for Reading and want to talk through the latest kind of data position for this agenda item. If we could just go on to the next slide. Before I kind of dive into the data, it seems appropriate to make reference to the situation we're in kind of nationally now, obviously a somewhat different position to that which we were in when we had the first of these meetings in early September. So clearly, as of yesterday, we moved into the new national restrictions, sometimes referred to as the new lockdown, call it what you will. And in a moment, I'll go through the data and kind of show what's been happening in Reading in the last few weeks, and will show some of the increase that we've been seeing locally. Undoubtedly, moving into a second lockdown is not a position that anyone would choose to be in, and there are clearly impacts on all of us personally. There are impacts on those who are more vulnerable in our communities. There are impacts on the economy, to name but a few. It is also worth noting that this does provide us with a little bit of opportunity in Reading, and I just wanted to touch on that before going into the data. So we were seeing an increase in case numbers in Reading. We've been seeing that over the last couple of months, and we were looking at whether the tiered system, and being in tier 1 of the 3-tiered system, was the right tier for Reading or not, so that we could try and arrest the increase we were seeing. So being in this lockdown situation, the second lockdown situation, although not being something we'd want to be in, does give us an opportunity to arrest that increase that we've been seeing, particularly as what we note in Reading is that what's been driving the increase in cases is primarily general community transmission and some household clustering. So as opposed to large outbreaks in very specific settings. So it is an opportunity for us. It does also mean, and we've touched already in this meeting through the question from Mr. Lake about contact tracing and isolation, it does give us an opportunity also to fully embed the local contact tracing that we're now undertaking in Reading. It does also give us an opportunity to ensure that we've got more robust testing facility available. There is work also going on at pace in terms of how delivery of a COVID vaccine could be implemented, and it also gives opportunity for further development of that. And if we can comply with the restrictions that we now have kind of set centrally, it gives us in Reading an opportunity to exit the kind of national restriction situation we're in currently at the lowest possible rung of those local alert levels that we had started to get accustomed to before kind of yesterday's kind of change. So I just wanted to start by saying, acknowledging we're in a very different position, but by just highlighting the benefit to that for us in Reading as we kind of move into this hopefully short period of second lockdown. But to go on to the numbers, then, if I could have the next slide, and just to show you what's been happening in Reading, the data that I'm going to show you, we've managed to do some work to make this publicly available, and therefore for members of the board, for members of the press, for members of the public, part of the meeting today, you don't need to wait for these meetings that happen to be able to review kind of the numbers. A lot of it's been on the .gov website anyway, but we've put it all together on this Berkshire Public Health website. And there is a COVID-19 dashboard on there, which is updated daily. The information centre button that you might just be able to see on the screenshot there also provides information on what the current restrictions are in each of the local authority areas. And as we move out of national lockdown, that will be really increasingly useful to be clear what people can do, can't do, shouldn't do locally. So that's all contained on that site. And if we just click on to the next slide, the screenshot on the right just shows you there's a list of things I must do, the following things, and answers questions. Can I do this? Can I do that? And explains what the rules are in different areas, which will become increasingly useful. And on the left, the screenshot that I've put on there just shows you in the information centre the weekly briefing, and most of the data that I'm going to talk through now will be on every week, just on that bit of the site, so that people can have a look and see some of the details to themselves if that's of interest. And we think we're the first area in the country to have a dedicated COVID site for the public to be able to kind of access this type of information as easily as possible. So if you move on to the next slide, and I'll just kind of talk through the numbers as they are currently. So this shows you all 6 local authority areas in Berkshire, and also compares to the southeast and to England. And what we can see, if I first of all draw you to the 3rd column, which is cases per 100,000, and this is the number of people for every 100,000 who live in the borough who are tested positive in a week. And what we can see is that the Reading rate on there is 128 per 100,000, and the compared to other local authority areas, clearly not quite as high as Slough or the Royal Borough of Windsor and Maidenhead, but is higher than the southeast average. For context, we're lower than what's happening in England on average, and the England average is driven by the higher rates we've seen, particularly in the northwest, but in other parts of the country as well. So that's our current kind of case rate. Obviously is limited by the fact that not everyone with COVID has a test and has a positive test result. And that's because some people with COVID have no symptoms and wouldn't necessarily know to present for testing. If we look at the positivity rate, so that's in the 2nd column, we can see that that's at 6.1% in Reading, meaning that out of every 100 people that go for a test, it's just over 6 who test positive, and that again you can see the comparison there. So a little bit lower than what's happening across England, but higher again than the southeast rate. And then we've also included in this chart the cases per 100 just in the age 60 and over population group. And the reason for including that is that we know that that age group are at the highest risk of complications and death from COVID. So it's a very important population group to be monitoring closely. And our rate there is at 81 per 100,000. If we move on to the next slide, this is then just Reading only data, and it's the same indicators. And apologies, it's a bit busy. The reason I really wanted to show you this was just so that you could see over the month of October the scale of increase that has occurred. And again, if we start with the case rate per 100,000, so in the red, what you see is that in early October that was below 50 per 100,000. But as you move down, and actually there's another day's worth of data on this slide that there wasn't the last, that's up to 140 per 100,000. And when I was speaking and doing this update in early September, that rate would have been in single figures. So that just underlines the increase that we've been seeing in our case rates. And of course, the same is true then of positivity, where that was at around 2.5. That's increased up now to the 6.5 level. So that's just to show how things have increased. If we move on to the next slide. And to help do some of that comparator, looking at what's happening in our region, not simply in Berkshire. The numbers are quite small on there, but Reading is number 2 if your eye isn't immediately drawn to where Reading is on the map. And you can see the darker shaded areas are areas that have a case rate of over 100 per 100,000, and the lighter blue is where it's between the 75 and 100 mark. And there is a trend to the closer the geography of an area is to London, kind of within the southeast, higher the case rates have been, and generally more rural areas have slightly lower rates, and as there is generally more transmission in more densely populated areas. Next slide, please. And just to show again what's been happening over time then, so these graphs are quite small, but this is starting from the 1st of September, so around the time that we had our last outbreak engagement board. And you can see that at that point in Reading, our case numbers were pretty similar to the southeast and to England as well, so the southeast being orange and England being grey, whereas the Reading numbers being blue. But what has happened since early October is an increase in cases that have occurred in Reading above the southeast rate. And again, you can see by comparison what's happened in other local authority areas in Berkshire. And again, if we move on to the next slide, please. So to try and segment the data a little bit to give some insight, this is showing us a couple of things. So on gender, we're seeing that over the last 2 weeks, case rates are basically identical between males and females. Across Berkshire, we've seen 30% of cases being from Black, Asian or minority ethnic group. And we can also see the age breakdown there, where in Reading we have a higher proportion of cases who are in that orange colour, which is the 18 to 34 age group. And that, there's a few reasons for that. One of the reasons is that comparatively Reading has a larger population of that age range than some of the other local authority areas. We clearly have a large university, although that expands Reading and Wokingham. Helpful just to see a little bit what's happening in terms of some of the different population groups in Reading. Going back onto ethnicity for a moment, we can see that within Reading, and we talked about this in more detail at our meeting back in September, that the BAME groups in Reading are have a higher burden of COVID. They're kind of overrepresented in the COVID case numbers, and we've got pleased to have Acre with us today, who will talk to some of how the support has been kind of implemented in regard to that kind of later on the agenda. If we move on to the next slide, just to show you age in a little bit more detail. What we can see is, so this gets referred to as a heat map. All that this is showing you is the cases, so the case rate again, so it's per 100,000, so the same measures we've been using before, by the different age groups over the month of October. And of those 5 age groups, you can see that there's been an approximate doubling of numbers within all age groups over the month of October, give or take. The couple of things that I would draw out from this for the board are firstly that rates are very much lowest in our 0 to 15-year-old age group, which adds some weight to the advice from SAGE, the government scientific group, that despite being in a second lockdown, there is not the need to close schools this time round, because we're not seeing high case rates and high transmission within school settings. So that's one thing I'd highlight. The other thing I'd say is with the 65 plus group, because that's by number the smallest of the age groups within this table, the numbers there fluctuate around a little bit in a more volatile way, just because there's a smaller number. So statistically, it's slightly less robust. Therefore, I wouldn't read a lot into the fact that that number's dipped in the last couple of days worth of data on this chart. I think we are still seeing transmission and infection rates within the 65 plus age group. And clearly you can see that as has occurred nationally, the highest rate is within the 16 to 29-year-old age group. So if we move on, the last couple of slides from me. So the next one, I think, will take us on to consider what's happened regarding COVID-related death. I appreciate this isn't the topic that we want to have to discuss, but we need to look at it. So on this graph, the darker purple bars are showing you death that's been attributed to COVID-19 on death certificates, and the lighter shading is showing death from other causes. And the wiggly line that goes across from left to right is showing you what the average death rate is for that time of year, taken from over the last 5 years. So the two things to draw out from this are that, firstly, over the month of October, we have seen 7 COVID-related deaths in Reading, having over the summer period not been seeing any COVID-related death. And that again indicates that, very much shows, we're in this wave 2, as we're all aware. The other thing to say is that overall, the most useful measure of the impact of COVID is not simply death that's attributed directly to COVID infection, but what happens in terms of all-cause mortality and the overall kind of count of deaths in Reading over a year period. And at the moment, we know that's 28% higher than has been from the last 5 years average. And we know that there will be some death related to COVID that doesn't quite get captured on a death certificate as being because of the infection, or maybe as an indirect cause from being in lockdown, or from people seeking healthcare help in different ways during a pandemic. So that overarching measure is what's more useful in terms of understanding truly the impact on death rates locally. So if we move on, please. So just to show very simply within the southeast what's happening in terms of hospital admissions for COVID-19. So admissions have been increasing significantly again since kind of late September, early October time. And then the count of the number of people in hospital with COVID-19 also increasing. And clearly some of the rationale for this second lockdown is to avoid any overwhelming of the NHS with numbers such as these continuing to increase. And then the next slide, please. So I think just to note, we are continuing to monitor for outbreaks where there are 2 or more confirmed cases within a specific setting, and we haven't been seeing high numbers of outbreaks, but rather community transmission and household clustering, as I've said. But this just shows you in Reading we've had some. So in this data for the 2-week period, 1 within a care home, 1 within a school, and 4 within other settings, and we'll touch a little bit more on outbreaks and lessons learned at a later point in the agenda. If I have the next slide, please. So I think this is the final bit for me, and actually if we could move on to the next one, it's probably slightly more useful. Thank you. So this is just showing us what's happened across the town. So apologies that the text is fairly small, but hopefully you can make out what we're showing here are the wards within Reading, and in the blue it's data over the last 2 weeks, and in the yellow it's data since the pandemic began. And in both the blue and the yellow, the left-hand set of numbers is just the count, so the number of cases, and the right-hand set of numbers is the rate per 100,000 of population. And you can just see a little bit of the difference there, that in terms of case numbers and the rate within the wards of Reading. Because wards are quite small geographical areas, these numbers are very sensitive to, for example, a particular workplace being within that ward where there may have been a contained outbreak, or a care home being within that ward where there may have been some cases. So it doesn't directly equate to what the risk is to people who live in those wards, but is just a way of showing the data in terms of how it's distributed across Reading. And then if we move on to the next slide, there you go. That was the last one for me. Sorry. So I hope that's kind of been a useful kind of canter through the numbers and what's been happening locally. I haven't been able to talk and keep an eye on the chat, but happy to take any questions, Chair.
Thank you, David, and thank you for that. Really, well, I find it fascinating anyway with your figures. Yeah, really good presentation there. There are some points people have made in the chat, and maybe we can. What we'll do is we'll make sure we capture the chat and feed those into considerations, and if David spots anything, we can also just refer to it now. But do we have any members of the board or partners which got any comments, any questions? I mean, one thing I would say was what is interesting is the geographic spread is kind of what you might imagine. I suppose a real concern is around on both the area and the wards. You can kind of sense that some of the both the sort of the closer, more dense populated parts of the town, plus and areas where you've got quite sort of dense sort of shopping areas and mingling of people, but also the connection that's where we've got some of our Black, Asian, minority, ethnic communities as well is quite it is related. It's kind of what you'd expect, but I think also shows the importance of our challenge in terms of driving down the infection rates in those areas. So Meriden, did you want to ask that question up front rather than the chat, Meriden?
Yes, I was just going to suggest that we've got Parveen from the university.
Sorry, just to remind, can people introduce themselves when they speak so everyone knows who you are? Thank you very much.
Oh, hi, everybody. Thank you, Councillor Hoskin. I'm Meriden Peachy. I'm the Director of Public Health for Berkshire West, which is for Reading, Wokingham and West Berkshire Councils. And I was going to update the board on the outbreak at Reading University, if that would be helpful. Councillor Hoskin, and we've got Parveen with us from the university, who can actually give some more detailed information on what they're doing. It's reasonably significant. It's probably the biggest outbreak we've got. We, as the Outbreak Engagement Board, the Health Protection Board, we have already considered and signed off the Reading University outbreak plan. It's extremely good, it's very thorough, and we had some very good debates with Parveen at the board, and I've actually personally signed it off, which is a requirement now for all university plans. And this is a significant outbreak with over 200 cases, and anybody can see the progress the university is making. All the numbers are on their website, as well as all the action they're taking, which is great. And we've been working with the university on a weekly basis, and we did hold an incident management team last week to see if we could come up with more joint action to help support them. So I'm going to hand over to Parveen, who will tell you a bit more about how it's progressing.
Thank you very much, Meriden. So I'm Parveen Yaqub. I'm Deputy Vice-Chancellor at the university, and I've been leading on our COVID-19 response. My team, as Meriden has said, is working very closely with colleagues from both Reading Borough Council and also Public Health England, and we've been doing that for a number of months. Since the start of term, we've been meeting twice a week. Some members of the team are in daily contact. So together with our local health protection team, they're reviewing cases, looking for patterns of transmission and preparing the outbreak control plan that Meriden has mentioned. And I'm sure you're aware that we work really hard to establish a testing centre for the whole community, and that's now fully operational on our London Road campus. So as Meriden mentioned, last week we requested the establishment of a joint incident management team. And that was to provide us with guidance specific to the university community and with the support and reassurance as we were managing the uptick in our cases. When we looked at the data, the health protection team were confident that the transmission of infection on campus was happening through households and social activity rather than teaching settings. You can imagine where you have young people living together in groups of 6 or more, the risk of transmission is that much greater, whether they're living in private accommodation or in halls. We did find, looking at the data on transmission, that the teaching setting doesn't pose an identifiable risk given the safety measures that the university has in place. And actually staff cases are very low, and we don't have any reason to believe, looking at the data, that infections are spilling over into the community. Just after the establishment of the incident management team, which was established just over a week ago, the Prime Minister, of course, announced the national lockdown, and that was followed by the Department for Education publishing guidance for universities, which essentially said that universities should remain open, that students should remain at university throughout the lockdown, and that they should continue to receive face-to-face teaching at a level agreed with the local health protection teams, and we've been following that guidance. In fact, this week, our case numbers have gone down quite significantly. On Monday, we launched a Covid-19 support line, and that provides a central point of contact for staff, for students, for parents, and also members of the local Reading community who might have queries or concerns. We've had about 100 calls through that line since Monday, and it operates from 9 till 5 on weekdays and 11 till 4 on weekends. We also have an internal case management team that supports test and trace efforts, and that provides support for students or staff who test positive for COVID-19 and also their close contacts within the university. And I guess it's important to say that COVID-19 impacts all of us, so we want to reassure you that the university is managing the situation, and we want to continue working with Reading Borough Council and the local health protection team to protect all of our community, but I'm happy to answer questions.
Great, thank you. Any questions or any points anyone wants to raise on that?
So there is a question about ventilation. Is that
Well,
directed at university?
I think it may be relating to the outbreak control plan. However, it does seem relevant to the situation we're in terms of a university. So
yeah. Okay, so over the summer, we spent an awful lot of time monitoring ventilation. There is guidance about ventilation in the Department for Education guidance that came out in the summer, and that was updated in September. There are thresholds for ventilation and certain regulations relating to ventilation that we have been looking at. We have increased the flow rates of ventilation in all of our teaching rooms so that they comply with the regulations. That sets them at higher than the previous legal threshold. And we've also converted all of our mechanical ventilation to fresh air rather than recirculated air. In teaching rooms where we don't have mechanical ventilation, we have to have windows open. We're trying to use those rooms as little as possible, particularly since it's getting colder. So, and we brought in some external consultants since the start of term, and they're regularly monitoring the ventilation while rooms are occupied, because of course occupancy can change the levels of ventilation. They've been doing that since the start of term, and we're very confident that our ventilation, the safety measures that we've got, which include ventilation, seem to be working well, and we're certainly not seeing any transmission in classrooms.
Great, thank you. No one else has indicated. There is a good point that someone's raised, which we'll just come to, but I would like to thank you very much. But Meriden.
Yeah, unfortunately, my hand on my system doesn't work, so I have to use the real one. I just want to make one more point. We did have a look at whether students were congregating around pubs and restaurants, all sorts of things, particularly in the town. In actual fact, there's hardly any contacts or transmission related to pubs and restaurants in the town. So that's why we came to the conclusion that this is probably transmission within the student accommodation and across the accommodation homes.
Okay, thank you. That is useful. Thank you. So Hamel's raised an interesting point around how infections cases are spread between Reading and Woking. I presume it is on the basis of the location of that individual's residence. So they have to be resident in the Woking borough. It'll be a Woking case if it's in the Reading.
Yeah, and we did get a question today actually about whether we could separate out our data on the dashboard for Wokingham and Reading, and we're going to make a decision on that on Monday at our major incident team. So we will look at that. We will consider that.
Yeah. Tracing is absolutely essential because we don't have the sort of data that they have.
Yeah.
So we know we're really supporting them and trying to get them the information they've got back onto our health protection systems.
Great, thank you. Well, thank you very much for that update. I think that's really useful. It's really, both concerning, but what it's really good to hear the real close working between particularly public health and university, and the serious approach taken by the university to handle what is a very, very difficult situation and time for you, I expect. So I haven't got anybody else raising anything or wishing to indicate that they wish to speak or ask questions. So thank you very much.
Thank you.
Andy, you wanted to a point around GP? Did you want to raise that with the meeting?
Yes, hello, Andy Jachersky, GP and Vice Chair of the Health and Wellbeing Board. Apologies, my camera doesn't work since my computer upgrade. Yeah, I was just going to say, just start and ask the question of the public health team. We've been seeing results coming back for students who've moved to uni but hadn't got round to registering with the uni GP. And I know of a case who I saw in September. I know they were going to Manchester Uni, and 4 weeks later I got a positive test for the said person, and I knew they were in Manchester. So does Manchester know of that person, that they're positive there, because the data's obviously come back to the GP? How does that get resolved? Thank you.
And I guess also particularly relevant, does Reading know when it's the other way around for someone from Manchester? Thanks. Does anyone?
I can answer that. So we're actually going to send out some comms to students this week to emphasise the importance of registering with a GP in Reading if they haven't already done so. But we have communicated really strongly to students that they must notify us of a positive test as soon as possible, regardless of whether their GP gets to know the outcome of the test. And we're pretty confident that students are doing that. So we will find out that they've got a positive test regardless of where their GP is.
Okay, thank you. Thank you. Anyone else?
Chair, there was a question from Tom at the beginning, wasn't there, about whether GPs could offer referral to patients who are isolating if their contact details weren't being traced. I don't know if Andy was there for that question. Were you in the meeting at that point, Andy?
Yeah, I did see that. I'm not quite sure how the logistics would work. I mean, we get positive tests, and then we usually do a welfare check with that patient if they are positive to ensure whether they are not strictly checking whether they're isolating or not, because we're not the isolation team, but more so in those that checking from a health welfare whether they're okay from a clinical point of view, making sure they haven't got any severe symptoms, and also if they are isolating, do they need any support? But I'm not quite sure. Again, it's a question to coordinate with the public health team. You know, when we do get a positive test, how is the isolating, testing and tracing aspect working? Who's getting the results? Because we're not really part of the test and trace process. We're just here as clinicians to look after their physical well-being.
Okay, thank you. But I suppose we need to make sure. Oh, in fact, David Monday's indicating. David.
Yeah, thanks, Chair. So it was just to kind of come in on that point. So just to kind of clarify that that anyone who tests positive obviously automatically gets sent into the kind of National Test and Trace Service to get the advice about isolating and to find out who their contacts are. So that happens. We do have it gets called kind of a line list, but we do get from Public Health England every day a list of everyone who's tested positive in Reading, and it's something that I can access, Meriden can access, and others in the public health team, and we know individuals' names names, addresses, we've got their dates of birth, etc. So that information is shared with us in a appropriately confidential way, but it means that we're very well cited on what on who is testing positive in Reading, and then where they aren't engaged with the National Test and Trace programme, as we'll come on to later on the agenda, we've now got the local contact tracing offer to follow up on those individuals to ensure that that kind of isolation is occurring. So I think Andy's exactly right. I think the role for GPs specifically is about that welfare check when they get positive results coming through, and no harm in checking that they understand about what the isolation rules are, but that isolation advice should have already come through. And just to, I guess, to assure the board, there's pretty robust processes in place and good data sharing working to ensure that that's happening.
Thank you, Dave. And I guess it's it's important to ensure that we keep GP practices updated with the latest information in terms of signposting and support, so that they have that to hand if they need it, I guess. Thank you. Right, I don't have anybody else indicating, in which case, thank you very much, David, on the update, and obviously the element on the Reading University. I will move us on to the Outbreak Control Plan Communications update, and hopefully Nikki Barton is here to talk us through this. Nikki.
Yes, I'm here. Hi, everybody. My name's Nikki Barton. I'm the Communications Manager at the Council. Could the slide master move me on, please? Thank you very much. So last time I came to Outbreak Engagement Board, I gave a bit of an overview of what our communications strategy is. One of the things we emphasised was that with a pandemic and a situation which is changing so quickly, a communications plan will never be static. It will always be moving and evolving, and all we can do is kind of put a framework around it. But what we will have to do, and what we should do, is continue to evolve the plan to the situation. But there is a strategic framework around it, the principles that guide what we do. So I've outlined those here. First priority is to amplify the core messages. So we do need to make sure that people locally are clear what the requirements are on them. So, for example, in a second lockdown, to understand what the rules are they should be following, the clear public health advice around hands, face, space, when and how to get a test, and what they should do if they're isolating or if there's a lockdown. So that's our first priority. We have tried to make it local, and I'll show you on the next slides, I'll show you what I mean by that. But evidence that we have around behaviour change and around best practice in public health is that if you can make something local, or if you can give someone a reason connected to their kind of immediate family or community to give them a reason to take action, they're more likely to do it. So that's what we've done with our campaign, Do the Right Thing. We also have a real focus on our specific local, sorry, I've skipped point 4. We also identify key insights based on the data and push specific messaging. So one example is around isolation. It's already been mentioned in this meeting that SAGE were highlighting that less than 20% of people who should have been isolating were isolated. So that would be an example of kind of insight we would take from the data and produce additional communications around to make sure that people were clear what they were supposed to do. And finally, our communications are specifically targeted to our own local conditions. So that might be the specific local high-risk settings that we have. So working with our high-risk settings team in environmental health and regulatory services who inspect businesses, we've been working on where they find businesses don't understand particular rules or particular parts of the regulations. We've been producing additional materials that might be image-led or use simplified language or are very specific to their setting so that they can understand better what's required of them. We might produce stuff that targets the specific behaviour of groups and the reasons why. So, for example, we have some insight that in different communities there's a different understanding of what the word household means and who might be in your household and whether that's your specific building or a wider group. So we might target communications that better explain what household means, or we might address the specific needs of a group. So that might be easy read for people with learning difficulties. It could be translated materials for people who don't speak English. It could be audio materials for people who don't read well. So we've done a number. I talked fairly extensively at the last board about a lot of the translation work that we've done. We've continued that and expanded it with a series of videos, but we continue to kind of take the insights that come into us and try and produce locally specific and relevant materials. Next slide, please. So this is just one example of what the campaign Do the Right Thing for Reading looks like, where we're explaining the rules to people. Next slide. And this is an example of how we've tried to involve local people in the campaign. So we've got images taken in recognisable locations around Reading, including Forbury Gardens. We've got images from Whitley, Tilehurst, Caversham, various recognisable locations, which we're now using on our materials on social media, and also will be in location-based materials. Next slide, please. Thank you. So this is just a quick overview of the kind of communications activities we've been doing. At the bottom, I've listed them. So digital advertising, email and social media. We've been using ad bikes. If you look at the image on the far right, that's what we mean by an ad bike. This is an advert on the back of a bike, which physically moves locations. So in the key weekend at the end of half term, when there was Halloween, we had a bike moving around key locations. That one's on the university campus. It was also based at the Oracle. It went to Tilehurst. It went to residential areas where we know students live. So various different places around the town. The one of the centre images, the one there with Nisha, we've made a series of videos working with the hospital. We've made a series of videos with health professionals and doctors who speak additional languages. And so these have been recorded and are now being pushed out through YouTube and other channels where people might be watching videos in their own languages. So this is an example in Nepalese there. And Nisha is also has a slot on local Gurkha radio. So we're also working with her on what content might be included in her weekly slot to that target audience in their native language. Second from left is the poster. So that's an example of how we're using the images of local people in the communications and in recognisable locations. And on the left, something that looks a little bit different. Anyone who's under 25 on this meeting, this is targeted at you. So we have borrowed a campaign that's been successfully used in a number of other councils, which uses stars from popular culture. So this is Lady Gaga. Other members of the campaign, Dizzy Rascal and Britney Spears, also included in it. And this was a digital campaign which ran, we serve people this advert, and if they click on it, they take a short quiz. And the quiz questions were around when you should isolate, what the symptoms of COVID are, and what you should do if you get symptoms. And people who got the quiz wrong get retargeted with the correct answers, and people who get the answers right get asked to tell their friends about that messaging. So that's just some examples of the kind of communication that we've been doing around COVID in the last few months. Next slide, please. So just a very quick summary of it. There's lots more data that we look at behind the results, but just to give you an idea of the kind of results that we've had and the things that we're learning. So the images of local people and local places have been really popular. When we use them on social media, we get higher levels of engagement, by which we mean more people sharing them or commenting or liking them than for other kinds of posts. So we do know that it's effective to be making it specific to people's local area. We've been doing regular emails using pooling our data from various pools of data around the council. So we have currently a base of about 100,000 people that we're able to contact through email. And we're consistently seeing a 45% plus open rate on that email. So what we saw at the beginning, when we started back in March, was a higher open rate than that, and then it dipped, and it's now gone up again. So what that tells us is that we have managed to keep our messages relevant to people. We've done a bit of testing on kinds of messages and what kind of subject lines. We think we've now found the right balance, that we're getting the messages right for people. This is what they want to hear from us. And what we call the unsubscribe rate, so the number of people when they receive this email and unsubscribe, has stayed low. So we feel that we are giving people the right level of information and kind of information that they need, and we'll continue to use that. I've already covered the results of the digital marketing campaign, or covered that, so I'll just say briefly the survey mechanism. We got very good results compared to what other councils were getting around the country. So that's something we'll continue to do. And it was interesting to see, so even from that SNAP quiz, the SNAP poll that was in there, we could see that 3 times as many people were confused about isolating as they were about symptoms. So it was just able to give us a very quick piece of insight that we could then action through our other communications. But I guess just to watch out, it's very crowded on social media. So if I look back over the last week, we're trying to communicate about Halloween, bonfire night, COVID, remembrance. There are dozens of messages under COVID, the lockdown coming, continue to isolate, when to get tests, symptoms, get your flu jab. There are lots of messages out there. So we really do need to continue to look at the insight and prioritise the messages that we think will have the most impact. Next slide, please. So what we're going to do next, we will continue with those kind of business as usual activities, the digital campaign, the signs around town, website, social media. What we're going to do with the digital is expand it. So that original campaign was targeted at 18 to 29-year-olds. We're now going to expand that to all age groups in Reading and change the quiz to be about lockdown and the rules you should be following as part of lockdown, and then continue to ask people about symptoms and when they should be tested and what they should do once they've been tested. So hopefully more people will see that now on this board because it will be expanded to all age ranges. Obviously, we're talking more about lockdown messages, but we're also starting to prepare for post-lockdown because when there's a lockdown, it's obviously clear to people. It's the same message across all the national news, what everyone should be doing. But we will start preparing as soon as we can for when we come out of lockdown, because there will be questions about what local restrictions are in place. And clearly, there's going to be lots of questions about what is permissible at Christmas. And the final thing to highlight is that we will be doing a wellbeing campaign. So between November and January, we always do winter wellbeing and winter wellness activities, but we'll be doing a much more visible campaign across mental health and physical health, the importance of continuing to use the NHS for your medical appointments, your cancer screening, that kind of stuff. It would include focus on domestic abuse and domestic violence, and that it's okay to escape from that despite the lockdown, winter fuel payments, digital access, getting online, access to food, eating healthily, alcohol and drug use, giving up smoking. All of those things will be included in a much bigger and wider winter wellbeing campaign. Final slide, please. So I was also asked, so Brighter Futures, who manage our children's services, are a separate organisation with their own comms team, but I was asked to give a quick communications update on their behalf. So a few things on here that they've been doing, but the things I would highlight are, so clearly they're targeting young people with their own messaging, and they've created a new social media site on Instagram, a specific zone on the website, a closed Facebook group for care leavers. So there's a number of initiatives specifically targeted at young people, and also around wellbeing for parents and carers who obviously can be under a lot of pressure under the restrictions and during lockdown. And then the other side of the comms push is around schools. So Brighter Futures do regular communications with schools. Obviously, this has varied throughout the pandemic, depending on how serious. So it was much more intense early on, and it's a bit more intense now, with regular briefings for head teachers and passing messages on that need to go to parents through the schools. And those have happened more or less frequently, depending where we are in the pandemic. There's also been a bit more of a push around foster carer recruitment. I think there's some insight that, you know, with people's changed financial circumstances and the way the job market is and increased redundancies, some people may have more time or be at home more than they have been previously. So it's a good time to be recruiting for foster carers. So there's a bit of a push on that as well. And that's all from me on communications. Happy to take any questions.
Thank you. Thank you for all of that. So I've got a bit of an echo. I don't know if you can hear that at all. Right, any questions? I've got Mandeep of Health Watch. Was that covered in the presentation, Mandeep, in terms of what you wanted to ask, or did you want to ask further?
No, I think Nikki covered it in her next slide, actually, after I asked the question. So it's really interesting to know about the local approach. I thought I'd seen something about a survey from Public Health about messages. So I thought maybe some of that feedback might have been incorporated into that. But no, thank you.
Thank you. And I've got Andy Chichersky. I think would you like to ask your question?
Yeah, obviously in the last lockdown, there was the opportunities to go out and walk and we had lovely weather. Obviously now in the winter months, trying to tell people to get out, to get some exercise, to maintain their not only physical but also mental well-being in the colder, shorter days is going to be a challenge. But I think we should still be pushing that. That's still to happen. I went for a sunset walk yesterday after a day of Zooming and Teams meetings, and it makes all the difference. I think we just need to maintain those physical, get outside, get into the fresh air messages.
Thank you.
Yeah, if I could use physical exercise as an example, because the range of messages that we might include under that would be the importance of physical exercise, the importance of exercise for your mental health, and then we already have all these materials. We've put them out throughout, you know, the pandemic, and it's just a case of kind of gathering them together and reissuing them and packaging them. But we've got materials about, you know, types of exercise you can be taking and the fact that it's permitted to do so. There's stuff about, for example, women's safety. I've seen just this week a sort of piece on the BBC about if you're going to run on your own early morning or in the evening, how to stay safe. So there's that kind of thing. We've also got information about exercising, say, for example, you're housebound or even chairbound. We've got information and resources for how you can stay active, even if that is the case. So under each of these headings, there are a number of, you know, we would want to do a push each week, and there's a number of different resources that we can include under that.
Right, thank you.
If I could, Chair, if I could just pick up, there's one other question in the chat, if that's okay to pick up, about asymptomatic transmission. Could I just address that one?
Of course.
Yeah, so I just wanted to mention on that, Dr. Cowling, yes, I think this, so the question about not only focusing on symptoms and what you should do if you have symptoms, but also the fact that there can be asymptomatic transmission. We're addressing that under isolation. So if I took, for example, quiz that I mentioned, that's one of the reasons that we address isolation. In that we make it clear to people that there are times when you should be isolating, not just because you've got symptoms or you've had a positive test. And then the reason for that is because even if you have no symptoms and haven't yourself had a test, but you're in contact with someone else who's had it, you could pass it on. So what we don't have is a banner of be careful of asymptomatic transmission. What we do have under our other guidance and information that we provide to people is that the reason we're asking you to do X or Y is because you could be transmitting it asymptomatically, or you could be asymptomatic and be transmitting it.
Thank you. Thanks for that. There was one other point that was raised, question that was put, which was around, and you talked about working with environmental health, and we talked about ventilation in the university. And I know from my daughter's complaints about how cold it is, that ventilation in schools is obviously the message is getting through. So I suppose the question is, yeah, around getting the message out around ventilation more widely, and the work that we do about that.
Is that a question for me, Chair?
Well, yes, it is. I suppose it's
Yeah.
like, say, for instance, coordinating
Yes.
with environmental health to get messages out to businesses around the importance of ventilation, I guess, and in fact, in
yes, I think, yes, thank you. And it is also something that Dr. Cowling's raised. So I think the honest answer is that that's one for us to pick up next, to say, okay, so is this the new message for winter, and what do we do with this next? Another point I would make is not everyone sees everything that we push out, because we do target it. So as you've just said there, it might be that this is a message for schools and for businesses. So it might be that not everybody sees that message, but it is something that I'll pick up with the higher setting teams and with Brighter Futures about what those messages might be and how they would go out.
Great, thank you. Thank you very much. Good, I haven't got anybody else indicating. Thank you very much, Nikki. I think it's amazing the sort of breadth and width and the depth of stuff that we have to do in here, and it's obviously incredibly important. So thank you. Right, anyone else has indicated? I hope I haven't missed anybody, in which case we'll move on to, well, item 7, which is recent COVID-19 outbreaks, lessons learned. But I think we may well have covered certainly the university outbreak earlier on. Meriden, was there anything else you wanted to cover on this item? Meriden, you may well have done it and moved on.
Hi, Chair. It's David. Monday. I don't know if Meriden's had to leave or not, but this was the university item was the one thing we were planning to pick up against this. So I think we've effectively done it early. Yeah. So I think we should, if you're happy, then move on to the,
the that's fine. Item. I just want to make sure there's nothing else that wants to be picked up. No, that's fine. Okay, right, let's move on then to support the most vulnerable during winter and wave 2 of COVID-19. So I haven't got down here who's going to be doing the presentation or going to be taking this.
I think I'm starting here.
That would be me.
We've got a number of presenters for this item, so I can start it off. And then
Thank you. Yes, if you take control and work it all the way through, that'd be fantastic. Okay. Thank you.
So the agenda for this board contains a number of standing items as agreed. One of the things that we agreed that we would have is a thematic item each time, and what we decided we'd look at this time is to give an overview as to what's happening across sectors and across partnerships to ensure that we're looking after those that need additional support in our communities as we look at the winter months and now looking at wave 2 and additional restrictions on movement. So a lot of what we're doing and what we've been planning builds on what we learned during the lockdown that was announced back in March. And this has put us in a stronger position to be able to target some of our resources and efforts on those who need extra support as we go forward. And when we talk about people who need extra support at this time, that's on a number of fronts. So Nicky's already talked about some people in our communities needing more support to receive and to understand the latest information about COVID, and that might be about not speaking English as a first language, not being able to access information digitally, so we don't assume that that is the only channel that we use, and it can just be people who don't know where to take their questions about new guidance as the rules changes. Another group of people that we've been giving consideration to are those that have other health conditions, not COVID, but other health conditions, either established or develop other health problems at this time. They need to be able to access treatment and care services safely and understand how to go about that. So we need to take them into account. Thinking about isolation, and I'm not talking about COVID isolation now, I'm talking about social isolation, but people who experience that isolation and also loneliness, we know are at risk of a number of other health problems. And of course, social distancing puts all of us at greater risk of experiencing loneliness or isolation, but some people will be at greater risk. They may have had fewer social contacts before COVID hit. They may be less able to adapt to some of the alternative channels that are being offered. And we also want to talk here about people who might need practical help as we go through the next few months, practical help around accessing services and accessing supplies to stay well at home. That might be a very short-term need for people who are required to self-isolate for a short period of time, or it may be throughout the winter months, people that have got other challenges, which means that they're going to need extra help. So if I can go to the next slide, please. Thank you. So loneliness and social isolation being one of the issues that we looked at. It has been a focus in Reading for some time. It's one of the priorities in our current health and wellbeing strategy, and we've got a strong partnership that's working together across this. What we saw in the spring and early summer certainly was more people experiencing loneliness, experiencing social isolation and everything that goes with that. We did see an increase in demand for dedicated support services, and in response our voluntary sector in particular really stood up with a huge increase in the amount of telephone befriending that was on offer, which was fabulous to see. Not all of the need necessarily translates into a request for services very quickly though, so it's been quite important that we continue to work together to share intelligence about where we can see people are at greater risk, so we can do some proactive reaching out to people before they get to the point of being in a very difficult situation because of their lack of social contact. So some of the key messages that we've been sharing and building on is that loneliness is something that can hit people at any age. It is perhaps more often recognised as being a problem for people in older age, but younger adults can experience loneliness and isolation as well. There are particular life events which can trigger someone going through a period of isolation, and two of the most significant are bereavement and loss of jobs. And sadly, of course, COVID means that a lot of people have gone through those particular life experiences. We also know that poverty increases the risk of people being in social isolation, and we've seen the links there between the economic impacts of COVID for some people and then feeling shut off from their communities a little bit further down the line. And some of the feedback that we are getting from service providers has very much highlighted and illustrated the links that there are between loneliness and other both physical and mental health problems. If I can go on to the next slide, please. So partners have worked together across this and stepped up to find responses in different ways. Voluntary and community sector groups, by sharing intelligence, have been able to get together and identify where we have the gaps in terms of responses across the town. And groups have been very flexible in looking at revising their normal access criteria to make sure that groups that have been identified that perhaps are missing out can be supported. So, for example, we learned back in the spring that younger adults perhaps didn't have as many routes into support when they were feeling isolated as older adults. So we had Engage Befriending started to bring down its age criteria, so they were supporting younger adults. Launchpad extended their support service so that they weren't working just with people at risk of homelessness, but other adults as well. Age UK Berkshire, as you know, normally works with older adults. They have been supporting a number of middle-aged adults who are facing redundancy and have got concerns about their financial future, and they've stepped in to meet the gap there. We've also seen some new forms of delivery, and a major one has been moving to a virtual offer, which I'll describe a little more a couple of slides down. But we have also seen some alternatives, such as Reading MenCap have been delivering activity boxes to people's homes, and they've also partnered with a theatre company to run a baking challenge. We've also seen a dementia choir going online from the Younger People with Dementia charity, and we're also about to see our first online dementia cafe as well. Next slide, please. Thank you. David mentioned earlier some of the particular risks for older people around COVID and COVID complications. So it's right that we do continue to have organisations which maintain a focus on older people. Before we got into the latest national restrictions, we knew for our older community they were looking at a period of perhaps facing tighter restrictions across the winter than some younger people, so fewer opportunities for them to connect with services. So a lot of developments and variations on the normal service offers being put in place to make sure that they were still connected. Next slide. So virtually, one of the things that has been happening is a lot of support being put in place to help people to get online if that is an alternative. It's not going to work for everybody, but for some people with support, they are able to access the virtual world, and that does open up lots more opportunities. So Reading Voluntary Action, the university, and both of our local Age UK branches in particular have been doing a lot of work around putting support in place to help people to access digital services if that is potentially a way forward for them. United Nations Older People's Day on the 1st of October is something that we've marked in Reading in a big way for a number of years now. That is something that we did virtually this year. We did have a virtual coffee morning, which had, I think, 87 people come along to it. And so we've tested it out. It didn't work for everybody, but there was enough interest that that's something that's going to be kept going on a regular basis. In terms of mental wellbeing, our own Compass Recovery College for mental wellbeing is now running a range of courses online, helping people to develop their skills, their understanding and their emotional resilience. And those courses have been run for people facing mental health challenges within their own families, but we've also put on some bespoke courses that are for volunteers, befrienders, those that are looking to improve their mental health literacy because of the extra work that they're taking on at this time because of having to support more people remotely. More and more training is now available online across a range of subjects, and Reading Voluntary Action through their Befriending Ready Friends coordinator has been collating a lot of that and putting that out to people on a regular basis to help skill people up and also attract and increase the competence of a lot more volunteers who are working in that area. Next slide, please. Fabulous though it's been, the people and organisations have responded and adapted their services as we've gone through the different phases of restrictions in our ability to meet face-to-face. That does mean that there's then a challenge of getting information out to people about what is now available. So we have continued to offer a wellbeing newsletter, which largely goes out as a digital resource, but we do post out copies of the wellbeing newsletter to people once a month if they're not able to access information digitally. And as Nikki's mentioned, there's going to be a wellbeing campaign running over the winter, running into a new year, new you sort of campaign as well. We had a bit of discussion earlier about physical activity, and there have been some quite creative approaches to that. Get Berkshire Active, for example, has produced a series of activity cards that I know went out to unpaid carers and others, but people who were going to find it difficult perhaps to leave the house to get exercise. So they're offered a range of short exercises that they can do around the home, so they can incorporate physical activity into daily living without it being too onerous. Although I absolutely take the point about fresh air, and we will be encouraging people to try to get some fresh air where they can as well. Next slide, please. And going back to what we said about some people needing extra support around communication, we now have a new post within the Public Health and Wellbeing team focusing on communications and engagement with communities. And I'd just like to ask Nisa to introduce herself and her role briefly, please. You there, Nisa?
Hi, thank you so much, Janet. Thank you, Chair, for the opportunity to introduce myself. I'm very happy to be part of this board today. I would like to introduce myself. My name is Onis Nisa, but please just call me Nisa. I've just recently joined as an engagement officer as part of the Public Health and Wellbeing team. Here, my main task is to specifically engage with our seldom heard and minority ethnic groups with regards to the Reading Borough Council COVID-19 response. The aim of my role is to engage closely with these groups and get better understanding of their specific needs and concerns, and develop initiatives in overcoming any challenges that they may face to support the effectiveness of the Reading Borough Council Outbreak Control Plan. My core intention is to then be able to become an integral communicator between our communities and the council in an informal, open, informative and supportive way. I seek to better understand and to respond to their needs, particularly around communicating essential information to protecting people against the COVID-19 and its impact. Because as we widely known how COVID-19 has disproportionately impacted the minority, these ethnic groups higher than the general population. My email address is attached on the slide, and I would love to hear from any individuals, groups, organization representatives that are already working in this area to ensure that we linked up and work in partnership to reach as many residents as possible and best support our communities. Thank you so much for this time. Over to you, Janet.
I think if we go to the next slide, I think yes, Victor, are you there? Victor, are you still with us?
Yes,
Lovely.
I am.
Okay.
Can you
I'll hand
hear
over
me?
to you.
Okay. I'm Victor Kuruma, the General Manager for Alliance for Cohesion and Racial Equality. We are based in the Battle Hospital Gates, the 3 Gatehouse building. Our offices are located in the middle building. Next slide, please. Next slide, please. Right. We'll just rattle through the next 3 slides because they're just for information. In case anybody wanted to contact us, so that we save time. Next slide, please. Right, these are our core activities, promoting equality, community empowerment, and community cohesion. in Reading. Next slide, please. Right. Our role, part of our role, is engaging with the ethnic minority communities in Reading. And we have a membership of about 70, now 75 different community groups that are on our database. And we've got interested parties, a database of nearly 600 that we communicate with regularly. The lockdown threw challenges for everybody, not only for us. But key issues that we experienced was that it was a sudden and unexpected occurrence when the lockdown was announced. Office had to shut down. We didn't have access to our database and information, and we had difficulty, establishing link, connections with our service users to enable us to assess their needs. And of course, there were no allocated resources at the time, or designated resources to respond to a challenge of this nature. So we had to make internal adjustments very quickly to enable us to do that. In terms of our service users, they had all sorts of problems. These are community people and are used to communal life, and all of a sudden they were housebound with their children, and that did throw up serious problems within the community, within the people that we support. And among those are the Alafia, families. These are families caring for disabled children in Reading. Their link was with the Alafia support worker, and thankfully, in partnership with MENCAP, we were able to reestablish that service, which had been floundering for lack of resources. Most of the things initially that people needed were, food, medicines, and then it started building up as we were getting, understanding the nature of the problem, and childcare within confined spaces. Given the fact that a lot of the families that Alafia works with children with special educational needs and autism. So, and with time, the pressure of getting them engaged started to build up. There was limited play and recreation, homeschooling, particularly when you've got language difficulties as a barrier. Did put a lot of pressure on families. Again, we work with a wide range of groups. We have the Rose Center community, which are women who are survivors of female genital mutilation and culturally based violence against women and girls. The key thing that we found soon enough was, people needed emotional support. There was a lot of anxiety. They didn't know how, where, when to get information and advice. They started complaining about being, lonely in their environment, in their home environment. And we, some of the people that we work with have underlying physical and mental health issues. And so we had to reach out and see how we can provide them with pastoral support. Next slide, please. Next slide, please. Right. Internally, the readjustment we made to respond to the challenge was to redeploy staff. Back one, please. Back one step, please. Right, thank you. Was to redeploy staff. Our services were geared towards working with communities, small groups, community organizations, but not necessarily individual support, with the exception of Alafia and the Rose Center. So we had to change the focus of the services that we provided, and every staff became an emergency response officer, if you like, to make sure that we reached out to our community members and providing them the necessary information, advice, and support that they needed. We collected information from, the health and well-being team, NHS, DHFT, who oversee community mental health services, and we synchronized our laptops in the first instance to enable staff to access files from home, which was an imperfect solution because it only clogged up the file. You had to go to the office to be able to update any information. So we provided our staff with mobile phone allowance, and I encouraged them to be on call for our services, particularly those that were struggling. And we found within that group that, of the 180 Alafia families that we support, about 120 of them fitted the vulnerable category. So we had to find a way of linking up with them continuously. So I kind of got our admin officer to become a support worker to the Alafia family support worker, and to enable them to engage with families, calling them almost every day, just to make sure that they were okay and finding out where their needs are. And in responding to that needs, we linked up with we referred families to the One Reading hub, where they were able to get subsistence support. Some people had difficulties with their benefit system, and we engaged with the necessary authorities to try to resolve those. Some people, did not want handouts from states or state-sponsored communities. Some preferred, that they linked up with with a specific religious organization, and it became brokers for those to make sure that their needs were met, and to enable them to be able to cope with the lockdown. Next slide, please. Next slide, please. Right. Externally, we had to build ACA, as ACA is a relatively small organization, and we've only got 5 staff. And the strength that we've always relied on is our community network, our community partners. For larger community partners, we kind of shared information with them on a regular basis, so as to keep them up to speed with plans, strategies, activities, and support avenues that they could then pass on to their community members. For smaller community organizations, we had to engage with them on an ongoing basis. So we kind of widened our network of helpers. We brought, our strategy partners, our strategy and voluntary sector partners. We linked up with them so we were able to understand and to implement response strategies. And once we got that, we were able to break it down in a manner that we could then share with the minority communities. We also developed a COVID support form, which our support workers would then call families and get their basic information, which we then put on database and refer them to necessary agencies that would support them. We then, we had initiated, mental health Let's Talk meetings, which we meet in fortnightly before the lockdown, And we soon found that we could replicate that on, virtually or in Zoom meetings. And we started doing that. When we started, the first meeting, we only had about 14 meetings, but by 3 meetings in, we were getting up to 60, 70, and later on, even up to 90 people attending these meetings. And whilst we were there, we were able to invite, public service partners to introduce support services. We brought mental health experts who then gave tips and advices on how people could cope with the stress that came out of the lockdown. And of course, we had a wonderful team of volunteers who were, making links with particularly our elderly community members, from doing their shopping to bringing, collecting medicines and doing their gardens, just so that, during that period in a socially distanced where they can have somebody to talk to. Next slide, please. Oh, these are the partners, our partners in delivery. Utilivu Women's Group, which is largely East African, although it's now got a wide representation from other minority groups in Reading. Women with Vision is another group that was set up as part of our FGM campaign, and they're largely West African, but also have got representation from other groups. Green Act Business Services have been helping, unemployed BAME people with employability support. And Mojatu is our technical advisor and our publisher. We produce a bi-monthly magazine, and if you have information that you wanted to pass on to a wide network, you can simply pass that on to us. You can find its way into Mojatu, or we can share that. Women is a men's support group that we started 2 years ago and has grown from strength to strength. They're now kind of semi-autonomous of ACA. Although they operate out of ACA, they now plan their own activities. And the whole idea is so that men can, meet in a safe place and be able to support each other and share peer support. This group was very instrumental in providing a volunteer base that engaged with, that supported, our community members who were otherwise housebound. Next slide, please. Next slide, please. Hello, can you hear me? Hello?
You can see it. It might be a slight delay.
Can you hear me? Right.
Yes.
Okay.
Can you hear us?
Oh, okay. So how have we prepared for it? Because right in the middle of the last lockdown, we started forward planning, knowing there were going to be a lot of difficulties, coming out of it. If we've struggled over the years to contain the seasonal flu, then one can only imagine how difficult it would be with COVID-19, which is reliant on, as it's been said, a vaccine to try to slow its spread or to arrest the pandemic. So we started looking forward, and I gave a presentation to Transform Reading, who, organized by Alan Magnus, who used to work for Edinburgh Council. And as a result of that meeting, the group agreed to upgrade our IT system and provide us with a VPN compatible router. So now we can access files and information from home. We now better understand the needs of our communities and where we can access solutions for them. We now have an increased online community through our meetings. These used to be fortnightly, but now they're now weekly. In fact, as of last month, October, we've increased them to 2 meetings a week. Wednesday, we looked at general community issues, and Thursday, we looked at, we discussed mental health issues and support needed by community members. These meetings are open, and you can refer anybody to them. Information usually goes to the health and well-being team as well, and they distribute it just as much as we do. We've started a pilot community. We had started a community champions group, which were looking at health matters, and also that included our volunteers. And we've now got to the stage where we're discussing formal training, and we'll be approaching RVA to see how they can support us with that. And we're looking beyond what is a second lockdown, really, on how we can be more, integrate more members of the community in mainstream activities and getting them involved in different forums and strategic groups. But we needed to start from somewhere, so we started ordinary discussions in the first place, formed the group, and now we're looking at training them for that formal representation of community needs. We have young people who are running a pilot program for us on community radio. This would be based in our offices in Reading, and we're going through the process of registration, and they will then be leading discussions and sharing information to the community, the different communities on issues that affect young people, employability, opportunities, and whatever else. With time to time, we'll be inviting, our voluntary, statutory, and community sector partners to help us co-present and share information to the community. I'd cover the Let's Talk issues, that Zoom meetings that we hold for now twice a week. But in terms of reaching out, we've also started the Alafia Family Support Group, which is because we've again been supported to buy subscription to Zoom. So we're now using that, and we have resumed our family support group meetings virtually. We are receiving help and donations from people from the town as we engage with them. And one of the major plans that we have in place is the link, to address the link between financial stability and mental health and well-being. And we, in a presentation to Transform Reading, they have offered to donate 15 laptops to us so that we can start computer suite. Looking forward to the end of the lockdown, really, because one thing we found is that not all of our members are digitally literate or have access to to digital communication. And I think one of the big mistakes we make is that because somebody has a smartphone, then they know how to use it and how to access information. And we have found that people have struggled with that. So hopefully we'll be doing employability classes and digital education for community members. And again, it's something that we'll be reaching out to our voluntary, statutory, and community sector partners to support us in the rollout of that program. So that's what we have been doing and what we plan to do. So right now, as we're in lockdown, we're again, the office is open for 4 days a week, but we've gone back to 5 days a week so that we can link up with those people that need to be engaged with, that need to hear, different, have communication with different people, and so that we can be able to pick up then what need and support they have, needs for support they have, and see how we can help them to address it. Thank you. That's my presentation.
Thank you. Victor, I guess should we take all of the presentations and then take questions at the end, because we have Isabel Edgar Riancon to introduce the hub.
Hi there, yes, my name is Isabel Edgar Brionson. I'm the AD for our corporate improvement and customer services, and I've been involved in relaunching the hub offer, which is the One Reading Community Hub, and also I'll be talking to you a little bit about the contact tracing as well, which I've been leading. So if we just go to the next slide. I thought it would be worth just sort of touching upon when we set up the One Reading Community Hub back in March, the feel and the need of what was being driven through that hub was very different to what we're offering now, and that's primarily based on the government requirements at the time, both in March and now. So when we set up the hub, we were focused primarily on ensuring that there would be no customers that went without food, that were either shielding or extremely vulnerable. And so we went from initially providing a one-stop shop where people could call in, and then we turned that into what was essentially a logistics organisation of moving food parcels out to those most vulnerable. We took nearly 10,000 calls during that period up until the end of July, when lockdown was released, as was shielding. And it was, genuinely, it was a real team effort from across the voluntary sector, Reading, Council, and all our partners across public health as well. So it really gave us a lot of confidence in terms of what else we could do. And over the summer, since the service around food stood down, we've been working towards trying to put the One Reading Community Hub on a more sustainable footing, so that we, in response to any further lockdowns, now we had been working on the basis that we would be going through the tiered system, the medium, high and very high tiers system that the government had been talking about. And then we had to move into quite a quick situation when the change of direction from central government around a new lockdown. So I'll just talk a little bit now, if we go to the next slide, about the new offer. So it's like I said, it's a really different look and feel this time. The primary focus is around maintaining independence and self-sufficiency, while also staying safe and protected. And one of the big learnings that both central government had and at a local level was that we were building in dependency into the system at that time. And we weren't able to really direct our limited resources to those customers that most needed it, in terms of being able to do that sustainably on a long term. We were able to respond in that immediate moment, but to ensure that we were absolutely reaching those customers and putting our resources into supporting customers that really needed our help. There's been a change and shift in focus around what the government are now calling clinically extremely vulnerable customers, which previously, which replaces really the shielding customers that we had been working with. The advice and the letters have gone out to customers this week, so letters should be hitting doorsteps over the last couple of days, giving the new advice for clinically extremely vulnerable customers. It is less restrictive, although, and it is advisory as it was the first time round, but it is clear that there are potentially further needs, across our communities that aren't necessarily extremely vulnerable, but they do still have support needs. So I think the point around this for me is that if you have a letter that says that you're clinically extremely vulnerable, the pathway, the customer pathway for that is to register with the national system. What that will do is it will link you in with any priority shopping slots, and it will also record your need with central government, so they are better then able to support local councils in terms of funding and things like that. They'll use that information to get a real sense of how any future funding would come down to local government to deliver that support. So so there's a website that people can, the details of which are in their letter that they've received. They can log on to that. They can then there's a couple of things that they can do on that website. Firstly, they can register that they feel like they are a customer with potentially additional needs. They can also register for priority supermarket slots. And then finally, they can also register to say that they would like direct support from their local council. And then we receive that information on a daily basis at about 12 o'clock every day. And then our role is to call every one of those customers that we've received from the national service to see what support, additional support they would need. So that's the route for clinically extremely vulnerable customers. If we go to the next slide. So there's a requirement that the government have of us around clinically extremely vulnerable customers, and it's very clear what we have to do. Over and above that, we obviously have our hub operating, and this is, I'll put in the chat actually the contact details for that. But we never stopped running the hub. We were still receiving calls even when shielding and lockdown had actually ended previously. Although, as you can expect, the number of the amount of demand and the number of calls coming through that service were significantly reduced. However, as we were notified about the changes in the government strategy to move into a second lockdown, we quickly met with all our partners again. And remember, this is a Reading Council and our voluntary sector partners and community partners around this that have brought this together. And we met with them to agree, well, what does the new service offer look like? And how do we want it to operate? And one of the big learnings for us was that from the previous hub, that actually, and I think it's been reflected in a couple of the calls today, that there was a lot of ways that customers were being contacted. They could have been being contacted by their GP. They were receiving information from the local council, potentially from the hospital. Our wellbeing teams were calling customers. Our children's services and adult services were calling customers. And one of the pieces of feedback that we got back from that was actually that was really quite overwhelming. Some of our most vulnerable customers, you know, the intention obviously was to support those customers, but it was just a bit overwhelming with so many people calling and wanting to give that support. So we've been very clear about the roles and responsibilities of our internal services, who is calling who, and making sure that we don't have multiple calls coming from multiple service areas. So we've streamlined that, and we've also streamlined the pathway into the community hub by having a form that people can use to register their interest, and also we can do that over the phone with them as well if they can't use the form online. So we have really streamlined that. I think there's still some opportunities to streamline it further. We're dealing with the data downloads every day, and central government have improved the quality of the data coming through to us, and some of the issues that local government were having around duplicate data and things like that. So we're in a much better position than we were last time round in really being able to look at those customers and start understanding the customer types that are requesting support and information. Now, obviously, there is no national food delivery service, and there is no we have not stood up a council delivery service, but one of the things that we are doing is if there is urgent and extreme need, we have made provision for food to be delivered to customers in those circumstances. But more generally, the hub offer is really about wellness, and we're really conscious of going into winter that it's potentially a different set of issues that will be presenting to us. So we're linking in with the wellbeing team, linking in with their winter wellness campaigns, and making sure that that support is absolutely underpinned by the need out there, rather than what it was. It felt that we were doing a lot of activity, which was fantastic, but it was not necessarily directed in the most in the best places. So so the offer now is as it says on the slide there. So we're still doing supporting online shopping. We're still providing financial advice and signposting to that around debt advice and things. One of the new advantages of the government system is that you can also have priority slotting and ordering food online via the telephone, rather than just having to do it via the web. So that's a real improvement. Morrison's and Sainsbury's are providing that service, where they realised that there were a lot of customers that were not able to order online because it's quite a complex process. So we're encouraging all our customers that are not CEVs, so that are not clinically extremely vulnerable, to register for additional support through our website. And we're also reaching out to all those customers that previously had been in contact with us and were using the hub to make sure that, you know, as a welfare check, to just check in on them and make sure whether there's any other support or advice that they need in the interim and over the winter months. So work is going to continue there, and I'm happy to take any questions.
Thank you very much as well. I think we've got one last contribution. So this whole lot, and then should we take any questions and points? I'll remind people what we've covered. There's a huge amount, which of course is incredibly heartening. Do we have Eilish here?
Hello, am I there? Hello, my name's Eilish McCarthy, and I'm the Berkshire West CCG Reading Locality Manager. And I've been asked to talk about access to GP services in Reading. So we want to have a really clear message that GP surgeries are open and accessible, but it's the way that patients access the service that has changed. And GP practices are working really hard to care in a safe way for patients and staff this winter, to make sure that they can look after patients that are known or suspected to have COVID-19, but whilst also maintaining core services. And over the winter, practices will continue to use what is known as the total triage model. And this means that patients are asked to contact surgeries by telephone or online if they're able to initially, and their situation will then be assessed. And many consultations will take place over the phone, virtually, or online. Patients will be seen face-to-face where the GP thinks that it's clinically appropriate. And of course, there are certain routine care, such as cervical screening and immunisations, which can't be done over the phone. So patients will be going into surgery for those. And our communications team are working together with Healthwatch to produce videos for patients. And in those videos, GPs are explaining that surgeries are open and how to access them. And those videos will be published over the next few weeks. Practices in Reading are also able to refer respiratory patients who have suspected COVID symptoms and require a face-to-face assessment to the hub, which is being run collaboratively by GP practices in Reading and Wokingham, and it's run from the Reading Walk-in Centre in the Broad Street Mile. So that's a great support to GP surgeries. But patients can also self-manage by using the very good surgery websites or apps such as Patient Access. And this will give patients information on how to manage some conditions at home. But they can also order repeat prescriptions online and also register with the practice. And some websites have the facility for non-urgent cases, so something that wouldn't need a reply within a couple of days. And they can ask the practice pharmacist, the GP, or the receptionist a question over that method, and they'll get a reply. 111 is also available to patients, and that's also available by phone or online, and patients will be directed to the most appropriate service for their symptoms. And we mustn't forget community pharmacists who are highly qualified, and they can give advice on minor symptoms such as aches and pains, sore throats, colds, flu, earache and eczema, and they will direct people to their GP surgery if they think it's appropriate. We're also really pleased to be working together with Reading Borough Council to produce accessible communications for communities on health issues. So a video is being produced next week about the RBH, covering that it's safe to come to the RBH and that patients should still attend appointments if those have been booked, because we know that patients have been avoiding doing that. And as Nikki mentioned earlier, we're also working together with Reading Borough Council and the Winter Wellbeing Campaign to deliver some key health messages over the winter to our communities. Thank you.
Thank you very much. That's really a point has been raised by a member in chat about whether to consider telephone triage even after the pandemic as a possible idea for future working. I'll just leave that there as a suggestion, unless you wanted to respond to it.
Well, I mean, I think some surgeries had already started to adopt that prior to, especially for emergency care. So I think it's something that some GP surgeries will consider continuing. I think Andy's just done a thumbs up in the chat, so I think he's a big supporter of telephone triage.
Yeah, can I come in there, Chair?
Yes.
Yeah, I mean, telephone consultations is nothing new. We did it before, either as a form of triaging urgent on the day appointments, or patients actually wanted to have a telephone appointment. Obviously, with COVID, we had to revert to a triage first model. That was the requirement from NHS England for all working, for keeping patients safe, because everyone was at that time isolating at home at the start of the lockdown, and also keeping staff in the surgeries safe from people with COVID walking in, and for those patients who had to come into the surgery for their clinical care to keep them safe. So we weren't refusing to see patients, it was the safe way to handle the workload. And over the few months, the workload gradually built up to what it was before lockdown, and if anything's gone even greater than that in time. Face-to-face appointments have come back gradually. They are obviously less. Just thinking roughly what the proportions are, sort of anything between 50 to 60, 70% of appointments are dealt with over the phone. Roughly 30%, this is just GPs, 20 to 30% of their workload might be face-to-face, and we are still doing home visiting for our vulnerable housebound patients. To those who absolutely can't get to the surgery, we will still go out and see them. The only other thing I wanted to mention is that 111 is the access to all care to from GPs out of hours. So don't forget that there is GP cover 24/7. Surgeries are open obviously during the day, and there are many surgeries that do extended access appointments on Saturday mornings. Again, those are now done by telephone first. Some are using that opportunity for doing face-to-face appointments with nurses for cervical screening, as we're doing a catch-up for those that missed out during the lockdown. But if you have got a medical problem, either overnight or over weekends, then 111 is the way to contact a GP that works out of hours. You'll talk to a clinical team, including GPs, who will talk to you the same as they would do if you rang the surgery during the day. And again, over the weekend, the West Call out of hours service will then arrange to see you for a clinical appointment if it's needed, and they will come out to visit patients at home if needed. So I just would reiterate that there is a GP service 24/7. 999 should be reserved for true life-threatening emergencies. Any other time, please ring 111. If you do need an ambulance, 111 can call it for you, but 111 should be the first port of call. And yeah, I would reiterate that our community pharmacy team is very helpful, and many surgeries have now got pharmacists working within surgeries, so they can support patients with any sort of medication queries as part of our extended team that we now have in many practices. Thank you, Chair.
Great, thank you, Andy, for that. I think that was really helpful. So quite a number of really comprehensive and interesting presentations there about the huge amount of stuff that's going on, which is really heartening as we enter into this second lockdown. Any questions or any points anybody wishes to raise? Now is the moment. I haven't seen anybody indicating. In which case, I would just like to thank everyone for presenting. I'll say it's fantastic to see, the huge amount that's going on, and I feel that do feel that with that kind of strong working together, we're well placed to handle the challenges ahead of us over the next month or so. In which case, we'll move on to item number 9, which is the local outbreak control plan development. And David Munday, back to you.
Great, thank you, Chair. I thought what would be most useful for this item would be if we just updated on 3 elements of kind of local COVID control in Reading, just to keep members of the board kind of briefed on how things are developing in what is, as I'm sure we all understand, are rapidly changing waters, some of which I referred to earlier when presenting about the data. So I've scaled back what I was going to say about local alert levels, because obviously, being in this kind of national restriction kind of scenario now, but I did think it was worth just touching on them. And as you can see on the slide, I think most members of the board will be familiar with the medium, high, and very high levels which have been formulated. And this shows very simply what some of those alert levels mean in terms of restriction. And there's clearly more detail that government has published, which I haven't tried to put all together into slides for today, about those 3 areas. I guess the main thing I wanted to say regarding this, which I touched on earlier, was that we anticipate when we move out of the national restrictions, we'll go back into the tiered structure. So the tiered, I suppose it's probably most helpful to think of the national restrictions we're now in as kind of tier 4, if you like, of what we thought initially was a 3-tiered system. So we clearly would want to move into the lowest tier that we can, but still maintain the control of COVID in Reading that we need to see. And we'll await the details of the process of how it's determined into what level we move. And you know, and as the council has previously said, we will be doing that in collaboration with our council, neighbouring council areas, so the West Berkshire and the Wokingham areas, in reflection of the fact that urban Reading is a larger area than the borough of Reading, and we want to make sure that there's a cohesive approach to our area that kind of makes sense for residents and doesn't kind of provide contradictory kind of rules and guidance in different streets, etc. So Meriden Peachy, the Director of Public Health, will kind of lead on that, and the website that I referred to earlier will make it as clear as we possibly can for people what the kind of guidance is regarding the alert levels when we move into that kind of that kind of tiered approach. So I think that's all I'll say on the alert levels, because it's kind of a little bit suspended for now, but just to say, you know, we are anticipating moving back into it, and it will be an important part of how control happens kind of in Reading going forward in the coming months. If we move on to the next slide, the second thing to say then about how local control is happening is about testing and about access to testing. So when we had our board meeting 2 months ago, we were talking about the stories that were coming up in the press that we were all encountering, where people were having to travel, you know, very long distances to access testing if they were kind of going onto the government portal to try to get tests, or indeed they couldn't get tests at all. So we do measure the testing rate in Reading, and compared to September, where testing is now, there's testing rate is 3 times higher than it was back then. So we are definitely have access to testing in a far more established way than we did have a couple of months ago. One of the things that's helped with that is we've now have a testing site that's available every day of the week in the borough, and that's at the London Road campus of the university. So it's in a university building, but it is something that is open to all members of the public. You do book in advance, so you're through the government portal, but it is available for people from anyone locally to access. And the idea of that site is that, unlike at the Newbury Showground, where it's a drive-through site, this testing site is available as a kind of walk-up site, so you can access it on foot, and therefore for residents in Reading that don't have access to a car, it remains possible to access that testing site. We also have now the mobile testing unit that's regularly visiting Prospect Park car park, and so that's there today, and then there's 2 further dates in November where that is booked in, but it will also be coming to it will also be coming to Reading at other points kind of going forward. We are wanting to establish some further kind of more permanent sites in Reading to ensure testing remains access, and our work kind of liaising with the Department for Health and Social Care kind of centrally kind of continues on that. And of course it won't have escaped people's attentions, I'm sure, about some newer testing technologies becoming available. So there's been this mass testing work that's been launched today, actually, in Liverpool. It was announced a few days ago, and we're waiting to see how further kind of rollout of those technologies will become available to us locally as well. So that includes both kind of increase in availability of antibody testing, to looking to see if people have previously been exposed to the virus, although the work continues to try and understand what the presence of antibody means in terms of people's immunity to repeat infection, and also different ways of doing antigen testing, so looking for the virus itself and not simply having to do the process we currently do of looking for the viral DNA when we take samples from people, but looking at maybe proteins that the virus is releasing, and more rapid ways of being able to test. So more of that to kind of follow as those things get rolled out. So those are two bits of kind of how local control is working and will be working in terms of the alert levels and testing. And then the third bit, and we've touched on this already today, is about contact tracing and how that's working. And I'll hand over to Isabel just to describe what we're doing in terms of that local contact tracing offer.
Thank you, David. So yes, if we just go to the next slide. So currently we've embedded our contact tracing service into our customer services team, and we've specifically trained a significant group of a significant number of people to be able to undertake local contact tracing, if indeed the numbers of unsuccessful contacts from the national service get passed through to the local contact tracing service. So we're ready to be able to respond to that should the case arrive. So it's important to note here, and there's been some confusion around the contact tracing service. What we're doing is really augmenting and supplementing the national service. So where the national service hasn't managed to contact somebody, they've tried maybe for 2 days with 4 calls on each day, that individual would pass through to us and we would attempt to contact that individual. So as of the 5th of November, we have actually received 125, sorry, up to the 5th of November. We launched on the 23rd of October. We've received 125 cases that the national service wasn't able to contact, and in total we have been able to have a successful contact. We've been able to successfully contact 64 of those people. So these are typically difficult to reach people. So that's a really good success rate of around 52%. There's another slide. So I'll talk a little bit more about what we're calling a successful contact. We've also, as I said, we're looking at how we can step up our options, and we're also exploring at the moment a door-to-door contact tracing service that has proved quite successful in some other local authority areas. At the moment, we're just keeping an eye on the figures, because our success rate of 52% does actually mean that we take over, we take the local area contact tracing success rate over 80%, which is what Public Health England have said it needs to be an effective service. So currently, while we're exploring looking at door-to-door and bringing in other services, actually we are achieving what the government are asking us to achieve at the minute. One of the challenges that we've had again around this, as you can imagine, the data is complex, and we've had some significant cases where the cases haven't actually been passed to us for around 15 days after their first positive case. So we are still calling those contacts, because we do feel it's worth those cases rather, because we do think it's still worth contacting the people that they may have come into contact with. So we are still pursuing those, even though they're 15 days after the initial test. If we go on to the next slide. So this is quite small, but if you squint and look very closely, you might be able to see it. So what we're deeming as a successful contact is where we have called that case, and they have provided us with all their contacts that they can recall, and we have uploaded that to the CTAS system, which is the national system. And from there, the national team take over contacting the contacts. But we have also had, we also have some other contacts which we're not counting towards our success rate, but we have successfully contacted them. So we have some customers that are refusing to take part. They put the phone down on us, and they, when we attempt to call them back, they've blocked our number, so they're not willing to take part in the contact tracing. So although we have managed to get through to them, probably picked the phone up because we're a local contact number that we're coming through on. So they've picked the phone up, but they don't want to take part. We've also called some customers that are unfortunately too ill or unable to take part in the scheme, and we pass those back to the National Service. And then there are some where we've managed to talk to them, but they have sufficient information. They can't remember who their contacts were or who they've been around. So we are saying that we've contacted them, we pass it back to the national system, but we're not deeming that in our stats as a successful contact. So that's probably all to say. It's still early days, and like I say, we're watching the figures to see how we can flex the service up and down. The expectation from our teams is that we are likely to see an increase in the numbers passed through to the local contact tracing, but we are very well placed to flex up our services should the need arise. Thank you.
Thank you as well for that. And well, what a shame it is that local councils don't run the contact tracing, the whole lot of it, and have the money to do so. But never mind. Really good. I think that's really good performance from the team so far, on the basis that we're talking about the cases that the national system has failed with. Although it has been put in the chat, it's also very worrying that some cases are coming through to us so late in the day. We'll see how that progresses. Right, any questions, any points anyone wants to raise about those two items? I've seen anyone indicate, in which case, thank you very much. Yeah, thank you, and well done to the team on what I think is a successful first week or so there. No one's got anything else to add then. We've just got the date of the next meeting, which we've got a date, Friday, 26th February 2021. As previously said, if we do need to meet before then, we will do. There's a health and wellbeing board in between as well. I can't remember the date of that. Clearly, we just don't know what the future is going to bring, as we've seen so far. So thank you, everybody, for coming along. Thank you for everyone who's done the presentations and provided that information. And I think that gives hopefully a good overview of sort of the preparations and the hard work going into preparing us for this next phase, this lockdown, and what the next weeks will bring. In which case, I say is thank you, and everyone take care over this lockdown, and have a great Christmas. If we don't speak to you before then. My kids are talking about Christmas a lot. I ought to stop. Thank you very much. Bye.
Thanks, Chair. Thanks, everyone.
Thanks.
Thank you. Bye-bye.
Bye.